Hi there, my name is Laura Simmons. I'm here with Scott Simmons, and we are going to do the neurological system. Scott, do you give me permission to record this?
Yes.
Okay, well then we are going to get started. I'm going to ask you some questions. We're going to go over the cranial nerves. Cranial nerves 1 is your smell, olfactory.
Okay.
Do you have any trouble smelling?
No.
Okay, so typically in the office we would have the patient close one side of your nose and then introduce a spice or something different for them to smell.
Okay.
But since he doesn't have any issues, we're going to just go on to cranial nerve 2, which is visual acuity. That's when we would do the ophthalmic exam and use the Snellen chart to check his eyes.
Okay.
Also, I'm going to have you cover one eye.
Okay.
And then how many fingers am I holding up?
2.
Up here?
2.
Okay. We would do both sides.
Okay.
But we don't need to.
Okay.
So if you could just follow my finger. There you go. Okay. Thank you. Next, I will have you, let me see, I'm going to palpate your TMJ and I want you to clench your teeth. Okay, move it side to side. And back and forth. Can you do that?
Mm-hmm.
Okay, good. So cranial nerve, let me see, that's cranial nerve 5.
Okay.
So then we're going to do the facial movements. Can you lift your eyebrows? Close your eyes tight. Smile. Open your eyes. And puff your cheeks. There you go. Thank you. Now we're going to go to hearing. We would do the Weber and the Rhine test with the fork, but I don't have it with me. So we're just going to continue. We go to cranial nerve 9 and 10. Do you have any trouble swallowing?
No.
Okay, can you swallow for me? And at this point, I would have him, with a pen light, have him open his mouth and say, and then just take a look at the tongue also. Then we're going to go to cranial nerve 11. I need you to lift your shoulders. There you go. And then cranial nerve 10 is with his tongue. So if you just stick out your tongue, it's symmetrical. No problems there. You can put it back in. Next, we're going to work on coordination. So the coordination, can you do, I'm going to put my finger out.
Okay.
You're going to, with your finger, you're going to touch your nose and then touch my finger.
Okay.
Whenever I move it. There you go. Thank you. Lower extremities. Can you put your heel to your shin? There you go. The other way. Okay. You can have a seat. Then I'm going to have you stand up.
Okay.
And just walk across to look at your gate.
Okay.
Just normally. Okay, if you can just keep standing up, arms forward. There you go. Palms down. And if you can leave them out in front of you.
Okay.
And then close your eyes. So this is the Romberg test to see if he sways. Now I am going to push your arms. And there you go. That is the pronator drift.
Okay.
Okay, you can have a seat again. Next, I'm just going to look at your muscles. You're wearing pants, so that's kind of hard, but there doesn't seem to be any atrophy, no contractures, no, they do look symmetrical and contour. So if you could do me a favor and put your arms out in front of you.
Okay.
I'm going to try and separate, and you're going to resist.
Okay.
Okay? There you go. I'm going to try and put them together. Ooh, okay. If you could do that again, and we'll do that with the wrist. Up, down. Okay.
Okay.
And how about if you can turn your hands over? And I'm going to try and push your fingers together. You keep them separate.
Okay.
There you go. And then if you could just grab my hands, my fingers, and squeeze. Good grip.
Okay.
And then we're going to work on, you did your finger adduction. So what I'm going to do is if you can just turn yourself a little bit.
Okay.
Oh, wait, this way. Straight
Okay.
up, straight towards.
Straight forward?
Yeah.
Okay.
So I am going to push down on your thigh and you're going to resist.
Okay.
Okay? There you go. I'm going to push up and resist. There you go.
Okay.
Okay, I'm going to need you to take off your shoes.
Okay.
And I'm going to do the same thing with your,
okay.
There you go. And then push like your gas pedal. There you go.
Okay.
All right. And then I'm going to, there you go. All right. We did your knees. We did your ankles. Now we're going to do some sensory.
Okay.
Okay. There is something, I'm going to touch you lightly. Close your eyes. Touch you lightly. And then if you can tell me what it was.
Something soft.
Yes.
Okay.
Okay. And then how about?
Something pointy.
Yes, sir. Then we would do hot and cold, but I don't have it right now, so we can move on. We're going to do the proprioception. So I'm going to hold. Can you feel that?
Mm-hmm.
You feel it moving up and down?
Yes.
Okay. I was holding on to his big toe by the sides. We would do then vibration with the tuning fork, of course. We did the light touches. I'm gonna do the stereognosis, which I am gonna have you close your eyes, hands out, and I'm gonna put something in your hand, and then you're gonna tell me what it is.
Okay.
Close your hand.
It's a cup or something like that?
Yeah, it's a measuring cup.
Measuring cup.
Thank you. Then we're going to do graphesthesia. So if you can close your eyes, hands out. I'm going to draw a number on your hand and you tell me what number it is.
Okay. 6.
6 is correct. Then we're going to do what we call 2-point discrimination. So I am going to touch you in one place and you can tell me if it's I touch you once or twice.
Okay.
Does that make sense?
Mm-hmm.
Okay.
Once. Once.
Okay. Actually, that was twice. That was with 2 different.
Oh, I thought you were talking 2 times.
Oh, okay.
Oh, okay.
So
Okay.
that's why
Okay.
I have my point.
Okay.
Okay. Then we would do point localization, which pretty much what I'm going to do is I'm going to touch you somewhere and then you're going to open your eyes and tell me where I touched you.
Okay.
Okay?
On my neck?
Yes.
On my arm?
Yes. Okay, so then we're going to do extinction. I have your eyes closed again. And then tell me.
That touches on my arms?
Yes.
Mm-hmm.
Sure. Thank you. So next we're going to do the reflexes, which I don't have my reflexes, but we would do the biceps, the brachioradialis, the triceps in the back. Then we would check for the knee jerk. And then back here, we would do an ankle, what we call an ankle jerk with the Achilles tendons to see if those reflexes are intact. Lastly, we are going to do the Grabinski sign. So if I have you lay down.
Okay.
Okay. I'm going to ask you to bring your neck to your chest. Do you have any pain?
No.
Okay, good. That is a sign for meningitis.
Okay.
Okay, and then the next one I'm going to do is I'm going to bend your knee.
Okay.
Does that feel any discomfort?
No.
Now we're going to try and straighten it. How about right there?
No.
Okay, that's the Kernick sign, and that's negative also for meningitis. So that is it for our video for today. Thank you.